Hello friends, let us now learn some important points about anti-hepatitis drugs. Anti-hepatitis drugs, if you see, the most common hepatitis is caused by hepatitis B virus. Exclusively this is caused by feco-oral route hepatitis is hepatitis E. Most commonly associated with hepatocellular carcinoma is hepatitis B more than hepatitis C. Most commonly associated with cirrhosis is hepatitis C. Now if you see the hepatitis B virus, in hepatitis B virus, it can be used in acute stage hepatitis drugs and chronic stage hepatitis drugs. If there is acute stage hepatitis, that is if the patient is HBs AG positive, then we should wait till anti-HBs antigens will develop and we should give supportive treatment. Then if there is chronic stage of hepatitis B virus, then we can give lamivudine. If there is chronic stage of hepatitis B virus, then lamivudine is given, which is an nucleotide reverse transcriptase inhibitors. Then we can give entecavir, which inhibits DNA polymerase. Then we can give tenofovir, which is a nucleotide reverse transcriptase inhibitor. Okay. Lamivudine is nucleoside reverse transcriptase inhibitor. Tenofovir is nucleotide reverse transcriptase inhibitor. Right? In chronic stage of hepatitis B virus, we can also give edifovir. This edifovir will inhibit DNA polymerase, and we can also give one more drug, which is talbudin. This talbudin also inhibits DNA polymerase. Now this edifovir is used as a side effect in lactic acidosis and nephrotoxicity, and this talbudin inhibits the DNA polymerase. Then if you see interferon alpha 2A, interferon alpha 2A is given in the dosage of 2.5 to 5 milli international units per meter square thrice per week for 4 to 6 weeks. This is used in chronic stage, and we can also use peg interferon, which is longer half life, and it is used in hepatitis B virus, C virus, AIDS related and also AIDS related Kaposi sarcoma. So these are the important drugs which are used in hepatitis B virus. So in the hepatitis B virus, all the drugs are already dealt in HIV. So the only drug which is not dealt in HIV is edifovir dipivoxil, which we will deal here. This edifovir dipivoxil, so this drug edifovir dipivoxil is a monophosphate analog of AMP. So if you see the mechanism of action, this edifovir dipivoxil is an esterase and liver and intestine, and here edifovir is phosphorylated to form edifovir diphosphate. This edifovir diphosphate will inhibit DNA polymerase, and this edifovir diphosphate is also incorporated into DNA, thus terminating the DNA chain. It is incorporated into DNA, thus terminating the DNA chain. So if you see the side effects, this edifovir dipivoxil causes sore throat, headache, weakness, abdominal pain and flu. It causes nephrotoxicity, especially it causes dose limiting side effects. It also causes lactic acidosis, hepatomegaly and steatosis are the side effects of edifovir dipivoxil. If you see the uses are, these are used for chronic hepatitis B infection. Then we have hepatitis C virus. Hepatitis C virus is actually for hepatitis C virus, previously we used to prefer interferon and ribavirin. Interferon and ribavirin are preferred previously, but nowadays we started using hepatitis C protease inhibitors, which include simprinavir, bosiprevir, bosiprevir, esunaprevir, teloprevir and grazoprevir. Simprevir, bosiprevir, esunaprevir, teloprevir and grazoprevir. This hepatitis C protease inhibitors will inhibit NS3 or NS4A serine protease of hepatitis B. This is the most specific drug and it is added with interferons with ribavirin and it is administered orally with food. Now this hepatitis C protease inhibitor will inhibit CYP3A4. Then this hepatitis C or protease inhibitors will also cause side effects like anemia and rash. The goal of treatment of hepatitis C is viral eradication is the treatment of hepatitis C. This is also associated with the concept of efficacy endpoint, which we will deal later. Rate of clearance of hepatitis C protease inhibitors rate of clearance of hepatitis C without treatment is 20 to 35%. So as a result, some physicians try to delay the treatment because they themselves clear out in 20 to 35% of individuals. Absence of viral detection even 24 weeks after therapy can occur, and this will show sustainable viral response achievement. It will achieve sustainable viral response achievement and thus causes efficacy endpoint. Then we have RNA polymerase inhibitors. RNA polymerase inhibitors are of two types. Those which inhibit NS5A inhibitors, which include daclotasvir, eltasvir, daclotasvir, eltasvir and ombitasvir. Then we have ledipasvir and velpatasvir. We also have ledipasvir and velpatasvir. Then RNA polymerase inhibitors also include those drugs which inhibit NS5B inhibitors. So these NS5B inhibitors include sofosbuvir and dosabuvir. Sofosbuvir and dosabuvir. These can be given without interferons. Then if you see the next, these drugs which we are seeing, this NS5A inhibitors and NS5B inhibitors, these are effective for all variants of hepatitis C virus. They are effective for all variants of hepatitis C virus. Example, we have velpatasvir and sofosbuvir. So these are the important points about the hepatitis C virus. Thank you for watching.